Okay, let's dive right into this. If you just gotten an MRI report for your back, I get it. It can feel confusing, maybe even a little scary with all that medical jargon. So we're going to spend the next few minutes creating a calm, clear map for that report. Before we go any further, I want you to really let this sink in. If your scan says one thing, mild bulge, but your pain feels way bigger or more complicated than that, this quote is for you. Seriously, it's the most important thing to remember. So our goal here is pretty simple. We're going to transform that confusion into confidence. And we'll do that by focusing on a really crucial concept called clinical correlation, which is just a fancy way of saying we need to connect the dots between the report and you, not just worship the image itself. So let's start with the big one, right? The main reason for all this confusion in the first place, why the picture of your spine doesn't always match how you actually feel. Think of it like this. Your MRI, that's a really detailed photo of a speaker. It shows the hardware, the physical parts, any changes in its structure. But what you actually feel, your pain, that's the volume knob. And that knob can get cranked way up by all sorts of things, like nerve irritation, stress, or not getting enough sleep, even if the speaker itself only has a few minor dings. And that leads us to the biggest takeaway of all. Your MRI is just one piece of evidence. It is not the final verdict. The report describes the tissue, your anatomy, but your symptoms, they describe your actual life, what you can and can't do day to day. And any good treatment plan has to look at both of those stories together. All right, now that we've got that straight, let's tackle some of those scary-sounding words you might have seen on your report. It's time to pull back the curtain and demystify this jargon. First up is the classic disc bulge. You know those little jelly-filled cushions between your vertebrae? Well, a bulge is just a broad change in the shape of that cushion. Honestly, it's an incredibly common, often age-related finding. Kind of like getting gray hairs, but on the inside. The shape itself doesn't automatically tell you how much pain you should be in. You might also see words like protrusion or extrusion. Don't get hung up on the words. They're just describing the specific shape of the change. And here's the key part. A smaller, more focused protrusion can actually be more irritating than a bigger, broader bulge, if it just so happens to be in the exact wrong spot to annoy a nerve. Again, it's about location, not just the label. This brings us to a really crucial idea, especially for a word like degeneration. I mean, in plain English, that sounds terrible, right? Like things are falling apart. But in the world of spine imaging, it very often just means normal, age-related wear and tear. The label is just describing what's there. It is not, and I repeat, not predicting your destiny. Okay, let's hit pause and address the most important question you probably have. When is this an actual emergency? It is so important to know the difference between something that's concerning and something that is truly urgent. Knowing the answer to this question is what's going to give you a sense of safety. This is how we separate the truly urgent signs from the ones that, while concerning, can be managed with a clear, calm plan. Okay, I need you to pay close attention here. These signs are rare, but you absolutely need to know them. We're talking about new or worsening trouble with bowel or bladder control, numbness in the groin or saddle area, where you'd sit on a horse, or severe weakness in your legs that's getting progressively worse, like you suddenly can't lift your foot. These are signs of serious nerve pressure. These are fire alarms, not calendar items. You seek immediate care. So here's the bottom line. How your body is functioning, especially when it comes to these red flags, is way more important than any word like bulge or degeneration on that report. Your function always, always wins. All right, now for the vast majority of people who do not have those red flags, let's take a deep breath. We can put the panic aside and build a simple, practical way to make sense of all this. Here's a 3-step framework you and your clinician can use to get organized. First, what kind of pain is it? Is it a deep ache that changes when you move or bend? That's likely mechanical. Or is it a sharp, zinging pain that shoots down your leg? That's more radicular. Second, check your neurostatus. Is your strength staying the same or is it changing? And third, and this is key, score the match. How well did the scan, the doctor's physical exam, and your symptoms actually line up? And here's a little secret that almost nobody tells you. You don't need a perfect 100% match to get started. A partial match is often more than enough to begin a smart, safe treatment plan, like physical therapy. You just need a reasonable starting point and a good way to track your progress. Okay, so we've got all this understanding. Now what? How do we actually turn it into action? Let's build a concrete plan you can use starting today to move from confusion to clarity. This is the most important part right here, because this isn't just about understanding a report. It's about empowering you to get back in the driver's seat and become an active participant in your own recovery. Taking back control starts with asking better questions. So instead of just asking, how bad is it? Try these. Which finding on my MRI do you think best matches my physical exam? And can you tell me why? What are the exact warning signs that you want me to call you about immediately? And what are 2 or 3 functional goals, like walking for 20 minutes or sleeping through the night, that we should aim for? These questions change the whole conversation from the report's scary words to your actual recovery. And this right here is probably the most powerful tool you can create before your next doctor's appointment. Just a simple 1-page match sheet. First, map your symptoms, where it hurts, what makes it worse, what makes it better. Step 2, just note your red flag status, a simple no to those urgent signs. Step 3, create a baseline of your function. Get specific. How many minutes can you walk? How long can you sit? And finally, list those top 3 questions we just talked about. I'm telling you, this simple sheet organizes your story and helps your doctor help you faster. Because when you approach it this way, you put the MRI back in its proper place. It stops being this terrifying, definitive headline and becomes what it was always meant to be. Just one piece of evidence inside a much smarter, more complete plan for getting you better.